Advocacy for better health is built on the premise that if citizens are aware of their rights and responsibilities, and civil society organizations have the capacity to empower and represent communities, they would have the confidence to hold their leaders accountable.
It became necessary to have advocacy because we believe that within the government systems, there are improvements that can be made.
Advocacy for better health has an objective of improving availability and accessibility of quality health services in Uganda. It supports citizens to demand for their rights and to be fully engaged in planning and monitoring of health services. In addition, it strengthens civil society organizations to conduct advocacy that can improve health-related policies, budgets, and programs. It is implemented by PATH.
We do implement other programs, so many other programs, vaccines, immunizations, family planning, maternal and child health. So we use those innovations and ideas from those specific programs. Then we use the advocacy for better health to actually drive.
It's a game changer. It helps everybody to realize his or her roles. And because of that interface, again, we understand each other better. Rather than everyone complaining, we find ourselves working for a common goal.
The communities have been able to demand for policy changes from decision makers and to hold them accountable for the quality of health services.
Twali tulina eddwaliro nga ddwaliro budwaliro naye nga temuliimu ki ddagala. Twatambuzza ekintu ekyo ne tutambula paka okutuuka ewa DHO nga tukaaba kiki kya ddagala, tukola public hearings, tuyita abantu sub-county number ne beewulirako ne batuwa ebirowoozo ne tubeera nga tubituusa paka ewa DHO paka ne mafooko nayo ng'etuyambako paka lwe twafunye eddagala ku ddwaliro.
Advocacy for better health has been working with partners and the media to avert a national stockout crisis of anti-tuberculosis and HIV treatment medicines and supplies. This is being done by raising both the national and international profile of the stockout crisis and working with networks of people living with HIV at national and district levels to collect evidence on stockouts in all the districts.
Working with Advocacy for Better Health, the support that we've been able to receive has been able to help us generate the evidence, which evidence we've used to advocate and engage and lobby and negotiate so that to alleviate a crisis here and there.
Reinvigorating Health Unit Management Committees, HUMECs, to provide an oversight role in the delivery of health services at health facility level is one area where advocacy for better health is registering success in reducing staff absenteeism.
My roles here, I do monitoring on behalf of the community.
When they came in to advocate for better health, they found many of our centers not having boards, what we would call health unit management committees. And those who had, they were dormant, or the leaders really didn't know what their roles were. So they worked very hard that the boards were appointed and they were taught or trained on what their roles were, and that has improved.
They are constructing 2 apartments to accommodate the 2 doctors so that at least they all live independently. I think that will improve services if we have resident doctors at the facility. It was sad to note that 2 doctors were sleeping in the same house.
We've seen, attitude of health workers improving because of the communities being aware of the way they're supposed to be treated, the hours health workers are supposed to work. So we are seeing a change.
We are focusing on domestic financing. We want to make sure that the budget for health is increased. We still use the Abuja Declaration of 2000 as the landmark or yardstick because that Abuja Declaration required the African governments to commit at least 15% of their budget to health.